We're Team 8 of the U21 Student Challenge, and together we will be exploring solutions to heat-related cardiovascular events driven by global warming.
A heat wave consists of a period of abnormally hot weather that can last from a few days to months, where the maximum and minimum temperatures are unusually high to our location. With further global warming, we can expect an increase in the intensity, frequency, and duration of these heat waves. Heat waves create a surge in demand for healthcare services and increase the burden, including ambulance callouts, slower response time, increased emergency and outpatient department visits, increased hospitalization, medicine shortages, and ultimately increased healthcare expenditures. During extreme heat, there is an increase in skilled blood flow to cool the body through sweating and evaporation. This physiological reaction may lead to dehydration, hemoconcentration, hypercoagulable state that causes strokes, and electrolyte derangement that causes arrhythmias. The risk factors are older population, older than 65 years old, lower and middle income countries, people with cardiopulmonary and other chronic diseases, and very young children, pre-existing mental health condition, people with paraplegia and tetraplegia, outdoor workers, women, pregnant women, and people who live in tropical climates.
We propose 3 data-driven strategies to address the growing risk of heat stroke and heat-related cardiovascular events: data-driven monitoring and dissemination of individual heat-related health risk, monitoring of population health data using AI, and improving cardiovascular disease diagnosis using AI. With widespread use of wearable devices, several apps have proven effective in monitoring cardiovascular health. Our first solution integrates this pre-existing tool for health data collection with global health research on heat-related health risks, alongside meteorological data like temperature and humidity, to provide real-time personalized heat risk assessments and dissemination to prevent heat-related illnesses before they happen. This requires intersectoral collaboration between health experts, meteorologists, data scientists, and software engineers to coordinate the fusion of physiological and weather data, develop algorithms guided by existing heat-related health research to determine individual heat-related risk profiles, and engage end users through an alert system through the wearable device.
Now, the successful implementation hinges on widespread popularization of these devices in heat-prone areas, ensuring financial capacity to purchase devices and legal regulations to maintain privacy, confidentiality, and data security. With the guidance of the WHO, involvement of key public, private, and nonprofit stakeholders in developing a comprehensive governance framework could complement implementation through promoting sustainable financing systems and ethical guidelines. Being affordable, easy to use, and accessible to anyone with a wearable device and internet offers the potential for extensive public use and harm reduction. Impact can be tracked through heat-associated healthcare cost savings and global heat-related illness and mortality statistics, with health economists, data scientists, and public health experts collaborating to process and interpret data for project monitoring and evaluation.
What if an AI model could predict cardiovascular risk during heat waves based on temperature forecasts, pre-exhausting risk factors, as we mentioned previously, like age or medical history, and existing global data? Our next proposal suggests WHO to use AI as an innovative solution to monitor the population on an epidemiological level. As highlighted on this map, this AI model can be trained based on data points totaling up to 1 million reports collected from 9 studies conducted across continents and climates, countries such as China, Japan, Singapore, the USA, South Africa, Brazil, and England. Here's more information about each study.
So various attempts have been already done worldwide to achieve what we propose by using local samples and assessing risk factors. And we suggest that the WHO allocate funding to bring these AI models alive on a global scale. There are already a lot of data sets available from existing studies, which include risk factors such as geographical location, age, and income levels. And following that, there are various machine and deep learning algorithms available that can be used to find the best fit for the model. Developing such prediction models can aid in the early detection of conditions like heart attack, stroke, and heart failure, allowing for a timely intervention. And this is also a safe, accessible, and cost-beneficial way to reduce cardiovascular incidents from heat waves.
Nowadays, big data plays an essential role in revitalization healthcare by providing new research insight, analyzing and recognizing high-risk population, managing health records, and improving operational efficiency. The Mayo Clinic in the United States combined AI with clinical practice to improve patients' outcome. They input more than 7 million ECG database, so once the patient came to the emergency room, AI trained with them how to analyze the presence of intracranial hemorrhage and the severity of the disease. This advanced method can help to prevent further long-term brain damage and shorten the time for diagnosing and recovery. Even for the developed countries such as the United States, 1 over 8 Americans experience financial hardship, and some of them cannot afford for the pills that keep them alive. Once a suitable AI algorithm is invented, it can save the cost by replacing some of the doctor's job and speeding up the medical system. Moreover, AI is an ever-growing system. It can help to prevent avoidable medical incidents in long term.
We recognize that solving this global issue requires collective effort. Through interdisciplinary collaboration, data-driven solutions, and considering socioeconomic determinants of global health, we aim to address growing disparities to ultimately improve health outcomes.